I had no idea where you would start with testing, given that the microbiome is different in everybody anyway. How on earth do you know what it is you're looking for that's unusual, unless you're just looking for a specific? But you've answered the question to some degree about when do you think it would be important for us to say to our patients, you might consider going to get a test. And yes, I'd appreciate getting that link from you if I can, because I will send it out by email to everyone who's watching.
Sure. So I think, I think all of your viewers who are medical professionals will have a sort of diagnostic algorithm maybe that they will go to and they will use in their standard practice. And it's about deciding for the specific condition that you're treating where that microbiome testing is going to fit into that algorithm. So the first thing to say is that a microbiome test is not diagnostic. So if you're trying to diagnose a specific pathology or you're trying to identify a very specific clinical problem, at the moment, microbiome testing cannot be used in that way. I think we're getting to that way. We're getting to that moment, and there are some areas where that's coming, and I can talk about some of those areas in a second. But what you're really doing is using it as a measure to get an understanding of gut microbial health and its basic microbial diversity. And increasingly I use it to explain symptoms and symptomology, or I use it to explain or to target therapy, particularly nutritional and dietary interventions, where I find it particularly helpful. I find it very, very helpful in managing patients with chronic gut dysfunction and chronic gut pain, typically patients with SIBO and kind of too many kind of IBS type symptoms. It can be extremely helpful. And it's very, very helpful in targeting those interventions.